The CDC says its Hantavirus response is winding down, and today, for the first time, we can name the doctor and hospital that actually monitored the exposed Americans. If you're just joining, here's the quick catch-up. The MV Hondius cluster began as an Andes strain Hantavirus outbreak on an international cruise ship. 13 illnesses, 3 deaths. And then came contact tracing across multiple countries, with passengers and crew quarantined or monitored. By June 18th, Dutch officials said almost all of those quarantined passengers and crew had been released after negative tests, and the CDC said U.S. contacts had finished monitoring with no U.S. cases.
This is Hantavirus Watch. So if the danger's over, why is a U.S. biocontainment unit suddenly making headlines? And what's still unanswered? Stick with us. If MV Hondius Andes-virus outbreak matters to you, hit follow. We'll be back on it soon.
AHA writes.
A rare hantavirus outbreak aboard an international cruise ship became a real-world test of America's infectious disease preparedness infrastructure. In this conversation, Angela Hewlett, MD, professor of infectious diseases at the University of Nebraska Medical Center and medical director of the Nebraska Biocontainment Unit, explains how her team helped monitor and care for Americans exposed to the Andes hantavirus strain, the only known hantavirus capable of person-to-person transmission.
So there it is. Angela Hewlett, medical director of the Nebraska Biocontainment Unit, is the first clear name and institution we've had on the U.S. clinical side. In the AHA interview, she walks through how her team monitored and cared for the exposed Americans from that cruise ship.
Nebraska. So that's where the contacts who came home actually landed. A real unit, not just some vague, monitored-at-home line. That's the first concrete answer we've gotten on where these scattered Americans went.
Right, and Hewlett frames it in the past tense. We're hearing a readiness retrospective now. The system got tested and the active emergency phase has passed.
Except the AHA put Hantavirus and Ebola in the same headline. I get why a biocontainment unit benchmarks against Ebola, but a listener hears that pairing and assumes Andes spreads like Ebola. It doesn't.
Good catch. We do have to handle that comparison carefully. Andes is the one hantavirus that can go person to person. That's why it got this attention. But Ebola's transmissibility is in a different league. The unit itself grew out of lessons learned in the U.S. Ebola response, so the Ebola reference is about the facility and its training. Andes still has a different risk profile.
So the building's resume includes Ebola. Fine. Doesn't mean Andes gets to borrow Ebola's fear factor. So when the CDC says it's wrapping up its hantavirus response, what does that actually mean? Like, what boxes have to be checked before officials feel comfortable standing down?
Yeah, because winding down doesn't mean case closed. The reporting says the CDC activated a Level 3 emergency response for this outbreak, the lowest of its 3 activation tiers. That means disease area experts were leading it with some emergency operations center support, rather than a full agency mobilization. Per CBS News, Level 1, the maximum all-hands response, has only happened 3 times in CDC history, so Level 3 was a pretty measured posture. By late June, Al Jazeera reported that CDC had formally concluded that response as the outbreak eased. Before officials stand down, they generally want the picture to stay quiet. No new confirmed cases outside the known exposure window. Contact tracing across the affected countries has to close out without new transmission chains. And the threat assessment needs to stay where CDC put it back in May. Low risk of a widespread outbreak. Around May 9th and 10th, CDC told the public that the Andes strain's known transmission dynamics, plus the agency's experience with the virus, supported that low-risk call.
But closing the response doesn't mean the science is settled, right? Are there still open questions that public health researchers would be watching even after the headlines move on?
Exactly. CDC published interim guidance on Andes virus exposure management as recently as May 10th, and interim matters there. It tells you the protocols are still being refined, not finalized. Researchers will still be watching for late-onset cases beyond the exposure window. They'll also want to see how the multi-country contact tracing closes out, and whether the clinical data from this cluster sharpens what we know about Andes-virus human-to-human transmission, the feature that has always set this strain apart from others like Sin Nombre.
If you come to Hantavirus Watch for clear outbreak updates, try Measles Outbreak Daily. Daily U.S. measles case counts, MMR vaccine policy, and outbreak tracking for parents, teachers, and clinicians who want real numbers. Find it wherever you listen to podcasts. Next, we're watching for the final closeout of multi-country contact tracing, especially any late-onset cases beyond the known exposure window. And for any CDC or clinical guidance that replaces the May 10 interim Andes-virus exposure management guidance. We've put links to every story from today's briefing in the show notes. So if one caught your attention, that's the place to read further. That's Hantavirus Watch for today. This is a Lantern podcast.